This is
Hi, good morning everyone. Uh, Thanks for waiting. So we'll start with the interaction today. I would like to introduce Dr. Sanjay Govil and Miss Srijita and Mr. Ajay. It's a very simple story wherein they had to undergo a small journey, which was just a small obstacle in their life, and which they have successfully overcome. And they are here to share their story with us. And if you have any questions, please leave it in the chat section. We'll get back to you on that. So, over to you, Doctor. We'll start with understanding the case scenario from Dr. Sanjay Govil.
just going to. Good morning and thanks for attending this meeting. So Mrs. Srijita and her husband live in Calcutta. She, as you can see, is a young lady who till very recently was perfectly all right. And just about maybe less than a month ago, about 3 weeks ago, she suddenly had an abdominal pain. And to her surprise, when she went to the hospital, to her surprise and I guess horror, she found that she had a cancer in her liver. At that time, the opinions that she and her husband received in Calcutta were that the tumor being in a very difficult location was very complicated to treat and may not be, this form of treatment is not universally available. And so they decided to come down to Bangalore to have this treatment. The journey, which should have been very straightforward, became very complicated because of the coronavirus pandemic. But fortunately, because of the the sort of working together of the Apollo Hospital in Calcutta and here, they were able to get whatever help they needed in order to be able to travel here for their treatment. Now, the tumor, I'm just going to show you some pictures. Essentially, the tumor was in the back part of the liver, and this big dark blue structure is a vein called the inferior vena cava, which carries all the blood from the lower half of the body. And this tumor, which is the red thing here, had wrapped itself around this vein. And these are the three main veins carrying blood out of the liver. You can see that two of them were almost completely blocked, and the third one was about half blocked. So we needed to do an operation in which we cut the liver like this and removed this portion of the liver along with the intervening vena cava. Now you can see that if we did this operation by the normal means, there would be torrential bleeding because these veins are large and carry huge amounts of blood. So we had to, in order to control the bleeding and make the operation successful, we had to do a kind of procedure in which we completely removed the liver from her body and did the operation outside of her body without any blood flowing. In this interim, while this operation was being done, we had to give the certain medicines and all that to the liver so that it would be preserved outside the body during this period without blood flow. And we were fortunately able to do this operation and remove this vein, this segment of vein. And then finally, we were able to, we joined it by putting grafts across the vein there and across the veins here, and then restored blood flow so that the liver could start functioning again. So it was a somewhat technically demanding surgery, which is not routinely available. And fortunately, things went very well, and she's actually just about 2 weeks after surgery now, isn't it?
No, fifth was my surgery.
Fifth. So today is, so just over, yeah, just about 2 weeks after the operation. and everything looks good. And sometime probably early next week, she will, or over the weekend, she might be going back to Calcutta to be with her children and her friends again. So that's a summary of the treatment that she received. This tumor came back as being what we call a hepatocellular carcinoma, or HCC. Fortunately, she does not require any additional treatment and just needs to be on close follow-up for the next few years to make sure that she remains free of the tumor. So that's a summary of the medical side of things.
Thank you, sir. So would you like to share something, sir, Ajay, sir?
See, to be honest, when she went through hell, most probably the pain started on 18th of last month, and she said she's having stomach ache and nausea was there. She was feeling vomiting and everything. So we said, "ठीक है, it might be a different thing because in this COVID times, even doctors don't want to you the patients to visit their chambers and all." So we called up our family doctor and he said 19th, 18th we passed. We said, okay, take painkillers for stomach and all. 19th we somehow managed to get him. He, by seeing her, he said because she's not allowed to touch her stomach also to check, it is better that she gets hospitalized. Mostly he was thinking that there would be some problem with pancreas or gallbladder stone or something like that. And he said straight away, let's today evening itself on 19th I'm talking about. Today itself you take her to the hospital or tomorrow morning max. You come there, I would be there, I will see her, and if need be, we will check and we will get her admitted or we will release her. That's, there won't be any problem. And what we did is simply when on 19th when I came home with her, right, she fainted. She was in tremendous pain and she fainted. Then I realized it is something serious now. And straight away I took her to Apollo Hospital in Kolkata, where she was admitted on 19th itself to the emergency. 20th they admitted her as per the procedures. They did the COVID test and everything, and then they moved her into the normal ward. From there, they did her ultrasonography. Ultrasonography they did, and they found out that there's a lump in the liver, which they said doesn't look good. Let's go for PET. Let's go for CT scan or something. Whatever they said. After that, they said let's go for PET CT scan, and it was PET CT scan. Most probably they said it's on the wrong side of the liver. Most probably doesn't look good, but let's do a biopsy to get it confirmed whether it's cancer or not. So while doing the biopsy, also we came to know that FNSC was done. We came to know that it is not the position is bad. The situation where the tumor is, it looks like not operable, which actually was shocking for me. In fact, and the time frame where the doctor started giving me was very difficult to understand. Where you find your in a week's time your entire world has shattered. So we consulted. We again thanks to Dr. Govil who said that he will operate. We got in touch with him sitting in Kolkata, and we somehow managed to send him few photographs of the PET scan, which was not visible. Still, he for 2-3 days he managed to coordinate with Kolkata Apollo from here, and what he did is he said, "Come, I will see and I'll operate," which was a big boost to us that yes, it can be operatable. It is operatable. It can be operated. We luckily the flight started for us. Luckily again, Karnataka did not ban West Bengal, Kolkata from the 5 states which they did, and we came here. We are really thankful to Dr. Govil. For us, he is godsend. I can tell you. I have been telling him for long, right? And whatever. Thank you so much. Thank you, doctor.
Thank you.
So one question which we have.
Why don't you ask Srijita to tell us her?
I don't know.
She is the main person in this story. We are all just on the side.
I really don't want to mention much about him. Only that he's God sent to me, and probably he and his team has done from the surgery to counseling everything that they could do for me.
Correct.
In one evening he comes and says, "That's okay. In 1 month, everything happened, and your world is like 180-degree round." So it happens. It continues. Like he did the counseling part also for me. So I can't be thankful enough to him.
No, it was a pleasure to meet you both and treat you both. So, thank you.
So one question is that like how can a tumor
Yeah.
be like undetected? Like how can it become seen in the last stage?
So the thing is that God has given us a lot more liver than we need. So unfortunately, this is a characteristic feature of liver tumors that they hide away in the liver, but the liver continues to function normally until they become quite large. Now, in a normal circumstance, we wouldn't expect somebody like Srijita to have this disease at all. It's extremely rare in her age group. Usually, the people who get this disease are cirrhotics, people with hepatitis B, hepatitis C, alcohol abuse, those kind of things. And in those patients, we actually advise them to undergo screening every 6 months, that they have an ultrasound every 6 months, because otherwise, by the time the disease is diagnosed, it's very often not possible to do anything. But in those high risk patients, if they have a scan every 6 months, we are able to detect the tumors when they are smaller than 5 centimeters, and in about 80% of cases. And then we are able to treat and often cure these tumors. But if they come only when symptoms appear, most of the time these tumors are large and can't be operated. So hers is not a common scenario, and we need what helped was, one is she was a young fit lady, and her liver, apart from where the tumor was, the rest of her liver was very healthy. So the only technically complicated part was how to make sure that we could, one, reconstruct all the blood vessels, and two, do it without excessive blood loss, which would have been dangerous to her life. So she actually, during the operation, she just required 2 units of blood, which is really nothing for this kind of thing of operation.
That's good to know, Doctor. Madam, we'll just have one last message from you, because it really needs a brave heart and a support also, like Sir was there with you. So what would be your message for rest of the people?
See, the time when I came from Calcutta, the way he talked about Dr. Govil, I knew that I will be in safe hands. So I came here. In 15 days, I came, I flew here on 3rd, 5th I was operated. He is that candid that he explained me the entire details of the operation. On top of that, he told me from where he will cut my stomach till where, so that I don't get an aftershock after the surgery. And today, from 5th my operation was done, and today, in this time, I'm fit and fine walking around. So I can't be thankful enough to him.
And to add, somebody, God forbid, some challenge you face with your liver, Dr. Govil is there.
Thank you for that. So on behalf of the Apollo family, we would like to thank you, and we are very glad that we are able to really help you through Dr. Govil, and we wish you a safe journey, and thank you. Thanks a lot.
Thank you so much for having us here.
Thanks.
Yeah.